Hi, this is Dr. Nick. I'm the Incrementalist here with incremental insights for a better business, better health. Today I want to talk about testing and testing out of quarantine, specifically the challenge associated with individuals that have been quarantined. So why do you get quarantined? You've been in contact with somebody who is tested positive. So they've gone into isolation, and as a result of that and being in contact with them for the specified period per contact tracing and our current guidelines on the transmission of this virus, you've been put into a quarantine circumstance. How do you get out of quarantine? Well, quarantine is essentially a time-based strategy, or for the most part, time-based strategy. Right now, we don't have a good methodology to allow an individual to get out of quarantine using testing. And part of the reason for that, if you look back at some of the other commentary that I put out, is that testing is variable both in terms of its performance, so the sensitivity and specificity depending on the test, but more importantly it depends on the timing. So the predominant strategy for quarantine and getting out of quarantine is a time-based process. So you wait the predetermined period from the point of contact to 14 days post, and that assumes that you have no symptoms and indeed don't test positive. In most instances, unless there's a reason to do so, we're not typically advocating for somebody to go into quarantine and have a test. Part of the problem with that is that we don't have the availability of tests. I think this is going to change over time, and again, this is one of the things that continues to develop. And at some point, we may even be able to issue some guidelines. And in fact, I think we can, as we think about different tests, different sensitivities, and a time-based strategy that says tests on day one and then test a number of days subsequently to make sure you account for the point in time that you would have or develop the virus that we would be able to detect with a pretty high degree of certainty. Because the last thing we want to do is to test you, say that you're negative, release you out into the community, and then you actually have the virus, importantly as an asymptomatic. So you present with no symptoms and you're now spreading that virus to the rest of the community. So it's a time-based strategy with an adjunct of testing potentially if you have access to the right tests and an appropriate timing of multiple tests. But in the absence of that, 14 days in quarantine determines your removal or exit from quarantine. And indeed, I think that timing may potentially change. We've certainly seen indications from other research and other countries where the duration of the quarantine is changing because we understand the viral incidence of spreading essentially is perhaps smaller or shorter than that period of time. But until we have good, solid information, it remains at 14 days. You have to think about that as a business, as a school, as an educational facility, and indeed in your own personal life, how you approach that. And it's important to sort of maintain this process and to get good advice so that you make the best decisions to prevent the spread of this disease so that we can return to some level of normality. This is Dr. Nick. I'm the Incrementalist here with incremental insights for a better business and a better health.